Good morning, good afternoon, or good evening, depending on where you are in the world. I want to welcome all of you, ladies and gentlemen, to the USACE virtual town hall. As of right now, we're tracking, we've got about 8,000 people dialed in, watching on YouTube, and appreciate your time today. This is a great opportunity to hear from our commanding general, Lieutenant General Semonite, and other senior leaders on the current COVID-19 situation across the nation and the USA's mission as we support the response efforts in support of the nation. Today's town hall will include hearing from the commanding general as well as other senior leaders, and then we will follow up with a Q&A portion, question and answer. We appreciate the questions that have already been submitted. There have been many, many questions, and as you know, in the 90 minutes that we have today, we're not going to be able to get to all of them. But we have taken the top 5 trending topics, and we will address those during the Q&A portion. And after that, we're going to go live to the YouTube chat feed. They're going to bring me some additional questions from you that may enter your minds as we go through the town hall. And we'll ask as many of those as we can. I want to let you know who's in the room today. As you can see, our 54th Chief of Engineers, General Semonite, and our 13th Command Sergeant Major, Brad Houston. We've got numerous experts here that will be able to answer your questions. Additionally, we've got our Deputy Chief of Engineers and Deputy Commanding General, Major General Bob Whittle. We've got our DCG for Military and International Operations, Major General Tony Funkhauser, and our Deputy Commanding General for Civil and Emergency Operations, Major General Scott Spellman. Additionally, we're joined by Ms. Karen Payne, our Director of Human Resources, Ms. Jill Stiglich, our Director of Contracting, and Mr. Tom Steffens, our Director of Resource Management. And finally, we've got our Corps Chaplain, Chaplain Brad Bauman, and our Command Surgeon, Commander Tom Janisco. Additionally, we've got Director of Contingency Operations, Mr. Alex Dornstadter, and our G3, Colonel Jason Putnam. So we're ready for your questions, and we're looking forward to this event. But first, before I turn it over to our senior leaders, I'd like to invite our chaplain forward to offer some words of encouragement.
Sir, Sergeant Major, leaders, members of the Corps of Engineers, first of all, I want to say good morning, good afternoon, and good evening, and thank you for this opportunity to briefly share a thought with you. Also want to say that I'm extremely proud to be your chaplain. Arthur Summers Roche, an American author and playwright, said, "Anxiety is a thin stream of fear trickling through the mind. If encouraged, it cuts a channel into which all other thoughts are drained." To say that we're living in strange and unprecedented times would be a gross understatement. Never in my years of military service and global deployments have I witnessed something of this magnitude. One thing I do know is the COVID-19 virus continues to create enormous stress on our families, tremendous financial burdens personally, nationally, and globally, and incredible levels of psychological anxiety that I've not previously witnessed. Because this is true, and as your chaplain, I'd like to make 3 commitments to you. First, I commit to pray for your families and for you individually each day. Second, I commit myself to counsel, encourage, and speak with you if you make that request of me. Third, and finally, for those who email me personally, I commit to provide you with a daily thought and a word of encouragement. Your emails have been received, and each response has been carefully read. The basketball legend, 6-time MVP, and 20-year legend of the NBA, Kareem Abdul-Jabbar, somebody who knew about leadership and teamwork, once said, "One man can be a crucial ingredient on a team, but one man cannot make a team." USACE, you are the best, and together we will overcome this challenge as a team. Essayons.
Okay, ladies and gentlemen, before I turn it over to General Semonite, I do want to add, if there's any awkwardness that you notice today, it's because we are making special efforts to practice social distancing. We're not using the same mic. We're all 6 feet apart. And for those of you who are familiar with the headquarters, 3M6070 is one of our bigger um, conference rooms, and we are able to achieve that. With that said, I'm going to turn it over to our commanding general, Lieutenant General Todd Semonite.
So I'm really glad you all tuned in to listen to us today. And although we only have about 90 minutes, we have assembled a pretty august body of senior leaders here. You can't see them all, but we've got a lot of the technical experts as well. So if we get into questions on human relations or money or other kind of things, we certainly want to answer that. I just want to give you some opening comments. And I think sometimes maybe the most scary thing of a disaster or a catastrophe is not knowing what's going to happen. We're in that position right now, and we don't really know what the next 2 or 3 weeks are really going to look like. But what we can't do is to be able to think that we have all the answers. We're going to be upfront. We're going to look in the eye. We're going to tell you what we know. We're going to tell you what we don't know. We're going to be as transparent as we possibly can. We aren't sure this is the best venue. We've never done a town hall for 30,000 people. And so we're going to try this. If it doesn't work and you want us to do this more at the local level, let us know. I'm not sure email is quite what we want to do from a personal perspective, but we want to continue to let you know what's going on, and whether it's a chief sends or whatever. We want to do this as often as you think. So write cards and letters back in. Let us know. We've got people that are monitoring to figure how we can do this better, but keep us in a loop. I'm going to make 3 points today, and I'm going to keep my comments relatively short. First of all, and if you've got your spouse sitting there listening and your kids, this is absolutely unprecedented times. Think back over the life of a person's career. My grandfather died when he was about 90 years old. Think about what happens in somebody's 90-year life that would be of this level of significance. And I just jotted down a couple. Sometimes I remember my parents always used to ask, where were you when John F. Kennedy was assassinated? Where were you when somebody landed on the moon? For those that are older, I'm probably before us. What happened during the Great Depression? What was 1929 like? Think about those that woke up on the morning of the attack at Pearl Harbor. What happened there, and where in the world did America think they were going to go with an attack of that level of significance? And I can't think of anything in the more recent history than 9/11, when we all stood there on TV and watched the first plane to go in that tower, and then the second plane to go, and in the Pentagon, and then out in Pennsylvania. And we had no idea what was happening. Most of those events were events that were relatively discreet. And once they got over, we had an awful lot of rebuilding to do, but we kind of knew that we had some degree of a path forward. We aren't sure where this one's going to go. We think we kind of know where the curves are going to play out, but this will be something you'll remember for the rest of your life. And your kids and your grandchildren will say, what was it like back during this? And it's just something that we've got to be able to do every single thing we can to be able to have our eyes wide open and to be able to go into this with all the right countermeasures in place. Second big message is to protect the force. There is nothing the Corps of Engineers is doing right now. We're doing $66 billion. None of that is worth getting any of our people infected, hurt, damaged, injured, stressed out. Work is going to come and go. I'll talk more about that on the third point. But at the end of the day, we have to go back and make sure we're protecting our people. Uh, we're going to talk to a couple of the other leaders here in a minute, but there's 3 or 4 big areas I worry about. First of all, what are you doing in your individual protection? I'm not going to reiterate all the different things that the CDC is saying, but don't be standing out in your neighborhood with 10 people in a circle having a cocktail on Friday night. Don't be doing a bunch of other stuff where you think you're going to be okay. Really go out of your way to do this social distancing. There are times now where we have meetings where I'm in one room and the other general's in the other room, and we really try to figure out how do we separate ourselves. What about washing? All the other kind of things, the standoff, all the things that you have heard, we are finding that those things make a difference. For those of us that have to come to work, we're very, very worried about making sure that you have protective capability at work. So, therefore, stay in your cubicles. Don't go into big offices. We've taken chairs out of conference rooms so you can't even have people more than 6 feet apart. And if you're out on the line, and we've got a lot of people with red shirts today out on the line doing mission, make sure that if you need a mask, make sure that if you need PPE, then you get it. And if you don't have it, then don't do the mission. Call your supervisor. We are in 50 states, we're in 110 countries. If we need to fly things in for your district to get the right level of equipment, we're going to do that. So make sure that while the mission's out there, you got to be able to protect yourself. I worry a great deal about mental health. Okay. Think about just, I mean, every now and then I go to Lowe's on a Saturday morning and I buy 2x4s and I build something just to be able to keep me grounded. What are you doing? What are you doing with your family? That could be good or bad. Sometimes it's probably good that your wife doesn't want you around all the time and now you're stuck in the same house. How do you make sure you get a little bit of distance to be able to go for a run or go for a walk or go whatever you need to do? So find out whatever you need to do to find the right place for you and just be able to calm down and bring the stress down a little bit. I worry about team building. We are an unbelievable team. We say in the Corps of Engineers, we're a family. It's hard to be a family when you're all teleworking and you're not collaborative. So don't be afraid to reach out to your local, the rest of your team in your office, the rest of your resident office, the area engineer office. Doesn't mean you have to be able to get together, but what are you doing to keep relationships out there? We aren't going to go into specifics today, but we have some people who got the virus and are all over it. A certain amount of people. We have some people that we think might have the virus, and we're watching them very closely in isolation. And we actually have some people right now that have the virus. We're worried about them. We're praying for them. But the bottom line is they're going to probably be okay. Who's talking to those people? Who's out there? And if you had the virus, or you are more, even worse, if you thought you might have the virus, it'd be nice to have somebody from the office call to say, how you doing? Have you taken your temperature? What's going on? What are you thinking about? Just to be able to make sure that you are in a good place and you know where you're at with respect to taking care of the team, taking care of the family. And it is, it's all about continuing you're in a well place. So we'll worry about your job security. The nice thing is you're federal employees. No one's going to get laid off. Most of America is worried about where the next paycheck's coming. Most of American businesses are worried about, are they going to survive this and to be able to keep their company alive? You're on the payroll. Don't worry about risks. Don't worry about shutdowns. Don't worry about any of that, because at the end of the day, you're on the core team. The core is going to keep you on the core team. Core's got a lot of work to do, and we're hiring, and we need everybody we can get. So we need you, and you're absolutely invaluable to us. If there's ever a chance to do some professional development, this is great. We got a lot of different tools. So figure out, are there some things you could get done while maybe you're teleworking to just try to continue to make yourself even better, so when you come back, it's going to be okay. So let me go to the last thing, and a couple of the generals are going to talk about this as well, but it goes back to delivering the program. You might say, why are we running around out in these cities, in these states, trying to help a state figure out how to be able to build hospitals? We are to the federal government probably as your local fire department and your local police department is to the little town you're living in. And at some given point, those guys don't get to take Christmas Eve off. They don't get to have New Year's Eve off. They don't get you just to say, I'm not going to go to work. I'm going to telework. Somebody has to step up and do what we need to do for this country. And that's the United States Army Corps of Engineers. We have been very deliberate in binning our projects into those that are mission essential that we have to do, and those that maybe can take a little bit of a break. There are some projects that probably can slip a year or two to the right, and it's not going to be a catastrophe if we don't get, a ecosystem restoration project done this year versus next year. On the other hand, we're building a missile site in Poland right now to protect America from getting, external missiles coming in. So how do we make sure that we're doing the critical jobs on things that are the security of this country. The VA is counting on us to finish the hospitals. So we're going to continue to work in VA hospitals. There's a lot of DOD facilities we need to do to keep soldiers alive. A lot of the installations are worried that they might not have enough hotel and hospital space on their military installations. So we need you out there in red shirts, white shirts, I don't care, white hard hats, making sure that when the Department of Defense gets the call, we're able to have the capability. And I certainly hope that nothing nefarious is going to happen, but we are seeing countries around the world that are stressed. And when countries get stressed, that means that we're going to need the Department of Defense to be able to ready react. And so this is where we've got to be able to stay in kind of a warm posture. What do we got to do this mission essential? And what can we let slide a little bit to the right? And it kind of goes back to everything we're doing. A lot of meetings we canceled, all the conferences, everything on the calendar, everything that's out there, we're able to push it off. And I would just tell you that this is of an order of magnitude that you've never seen. And at the end of the day, it's not going to be normal. When we come back, all your projects are going to be behind. You're going to have to re-baseline them all. Some of your projects are going to need more money because we're going to have contractors that we've had to stand down. All your meetings are going to have to be rescheduled. Your calendar is going to be screwed up. And all that is going to be okay because it's going to be fine. And we are very, very good at stepping up and figuring it all out. But if you think you're just going to be able to turn the switch back on and come right back into the office, it's going to take a long time for the Corps, and I think a long time for this country to continue to grow out of this. And that's what you have. You have the resiliency, you have the expeditionary mindset, and you have the passion to know that when America needs the Corps, you are the kind of employee that we have. And it really goes back to this whole idea of right now, we're not worrying about this necessarily for the national government. We're worried about your town, your city. We're worried about your church and the people that go to your church and the people that go to your Boy Scout troops and the people that end up doing your soccer stadiums and your neighbors. Because if the United States Army can't figure out how to build hospitals, I don't think a lot of these other states can. So just be aware that we're trying very careful not to volunteer for any more than we think we've got to do. But it goes back to our vision to engineer solutions for the nation's toughest challenges. And this is one of America's toughest challenges. Thanks for being on the net. I'll make some closing statements at the very end.
Okay, I'm Bob Whittle, Deputy Chief of Engineers, and the team asked me to share with you where we think this virus is going. And so I've got a few comments, and I want to point out some things that USACE is doing. So look, the United States Army Corps of Engineers, we're more than just one agency in the government or one agency in the Army. We're providing vision for the entire U.S. government and the entire Department of Defense. And so this is just one example. We're all trying to determine how the virus is going to hit the United States of America and its territories. And that way, if we know what the problem's going to be in the weeks and months ahead, we know how we can respond. And so Columbia University, they created a model of where the virus is going. And what our Army Geospatial team did under the leadership of Gary Bloom and Dave Hibner is put some products together that showed where it's going over the weeks ahead. Just last Saturday, we shared that with the Department of the Army, and within 24 hours, it was all over the Department of Defense. It was with all of the combatant commands. It was with the Office of Secretary of Defense and in the interagency. And so the model came from Columbia University, but what we do as engineers is we figure out how to make products, especially geospatial products, and share them. And so that went out fast. And the next problem that came up is no one really knew what was going to happen with the virus in Guam. And so we asked our Engineering Research and Development Center, under the leadership of David Pittman and Teresa Schlosser, to take a look at Guam and see if they could model it. And within 48 hours, they had created a model for Guam, which has been shared with U.S. Army Pacific and Indo-PACOM Command. And so it's really making a huge difference. All right, so since we have an idea, and I'll just tell you, the results of the model are really predictable. Quite frankly, if you're in a major population center, the virus is coming, and it's going to multiply in that population center. So what does that mean for the Corps of Engineers? So here are the basics on hospital beds across the United States. At any given time, during normal times, about 2/3 of all the hospital beds are full. And that means, of course, you're all engineers or working in the Corps of Engineers. That means about 1/3 are empty. And during normal operations, about 2/3 of all ICU beds are full and about 1/3 are empty. So when a virus like this hits, they start to fill up. And what we know based on modeling, and you can see it playing out in New York, is those beds are going to get full and we're going to need more capacity. And that's, as General Semonite pointed out, that's why the Corps of Engineers has this mission of building additional capacity or giving that same capability to our local and state partners so that they can also, if they choose to, do that on their own. So, are we going to be successful? You can stand on the top step of the Lincoln Memorial and look over your right shoulder and see Lincoln. And when you look straight ahead, you can see the Washington Monument. And just past the Washington Monument, you can see the Capitol Dome. All three of those things were built by the U.S. Army Corps of Engineers. If you ever need a confidence boost, stand right there. And if you stand there right now, nobody else is around. It's pretty incredible. And Lincoln, when you look back at Lincoln, he's in that chair, standing on the monument that the Corps of Engineers built, looking at two more monuments ahead of him that we built. And if you look at the expression of his face, you can tell that he knows this nation is going to get through it. And he knows that the Corps of Engineers is going to lead the way. Thank you.
All right. Well, good morning, good afternoon, good evening, everyone. I'm Major General Tony Funkhauser. I'm the Deputy Commanding General for Military and International Operations. And I just wanted to express, first of all, our thanks for everything you guys are doing out there and our best wishes to you and your families as you kind of work through all the challenges that are going on. We want to thank you for your ability to continue to execute the mission despite those challenges, which has not been easy for anyone. All of us here are experiencing the same things, trying to work and take care of your family. A lot of you guys have your kids at home teleschooling or doing whatever else. So it makes it quite challenging. But it's also been quite an inspiration from our perspective to see the organization mobilize and to a common cause achieve a great effect. And we're being recognized, I'll tell you, everywhere I've been to. I've got numerous meetings, teleconference, VTCs, and we're working with, we're working for FEMA and DOD, but just working with all those other agencies, I can't tell you the amount of folks that have come up to me and thanked us explicitly in front of other folks, saying thank you for everything the Corps of Engineers are doing out there each and every day. And we're seeing that manifest itself, really just starting to kind of see it kind of manifest itself right now in New York City, as you hear in the news about the Javits Center and all the things that North Atlantic Division and New York District are doing out there. And then just recently at Lakes and Rivers Division out at McCormick Place in Chicago. Lots of great things, and it's only the beginning of what we're doing. We brought a great team together recently of engineers and specialists from HHS and other folks from FEMA that came together and came out with a standard plan, right? It's a hotel conversion to a healthcare alternate care facility. And we had another option with regards to the arena to healthcare facility. And those were designed to kind of take out to all the districts, and it's an exportable package that we put on our website. And districts have been able to work with the state EOCs and develop site adapt concepts so that we could very expeditiously get what we're trying to do out to the field. And right now, the demand for our Corps of Engineer assessments is incredibly high. I think we're up over 500 assessments, and we've completed over 421 to date. 15 have been selected for conversion as of right now. 7 contracts have been awarded so far for about 8,800 beds. And about another 8 contracts are pending here in the near future for another 6,000 or so beds. So you should have a great feeling as you watch the news and talk to folks about what our role is in contributing to this nation's fight. A couple of things I want to talk about real quick is what our Huntsville Engineer Center is doing. We've given them the lead as the medical design center of expertise because we needed to have that centrified subject matter expertise in laying out engineering design concepts to basically guide and standardize the conversion of these arenas, convention centers, hotels, dorms, and now we're even looking at barracks on installations as alternate care facilities to accommodate patients. Our plans have been distributed worldwide, like I said, and adopted also internationally. We've had requests for information. So that's an impact that the Corps is having around the world. We've really focused on decentralized nature. So once we pass those packages out, we're looking for decentralized execution from our divisions and districts and look for them to use our local contractors and resources so they can execute rapidly with our emergency contracting authorities. We're even looking now at prefabricated containerized medical solutions that can accommodate COVID-positive acute patients. We're going to leverage the advantages of these enclosed systems to provide a negative pressure and care system where they're most needed. And these solutions serve as a force multiplier that can be delivered to the point of the greatest need as the situation develops rapidly around us. We're also looking at steps we can take to assist the Department of the Army with protecting the health of a force, the military force. And USACE is a key player, particularly right now for the Army, with the initiative called 6+. 6+ is about the 6 Army training centers and then the rest of the remaining Army enterprise. We're focused on identifying facilities and capacity where we can assist on the installations to convert. We're also looking at mothballed and decommissioned medical facilities that we have not demolished yet and see what we can do to leverage those to receive patients and add to that capacity. We've developed concepts to convert barracks and open areas on those installations as well as alternate care facilities. And our goal is an effort to leave no potential solution unexplored. And to demonstrate our commitment to this fight we've undertaken together as a nation, it's across the board everywhere we're going. We're all part of this big fight. Our Engineering Research and Development Center, also ERDIC, is hard at work collaborating and developing computational models on how the virus spreads in places to the continental U.S. and in places as remote as Guam, as General Whittle referenced. They're also developing 2 full-scale prototype models of containerized units with COVID acute care capability. And then we'll identify and push that information out to our districts so they can scope that into our contracts. Our Army Geospatial Center is also leading the development of a model to project how the virus might move into the nation so that our MSC and districts can anticipate and advise FEMA and state officials of the expected requirements. So everybody is playing a big role in how this is all coming together. But as we do all this, I want you to know that here at the headquarters, we're still managing the mission we've always had. It may look a little different through teleworking and VTCs, but the military mission is still hard at work delivering DoD, MILCON, SRM, environmental, and real estate programs. To include all the great work our barrier district is doing out there on the southwest border with South Pacific Division and Southwestern Division. I want to thank you all for this monumental effort and support and what you're doing to deliver every day. I wish you all good health and safety and look forward to being together with you guys at the end of this thing, back to work here at the office. Thank you all very much, and I'll turn it over to General Spillman.
Hey, great. Thanks, Tony. And good afternoon, everyone. My name is Major General Scott Spellman. I'm the Deputy Commanding General for Civil and Emergency Operations. I'm going to talk a little bit about this response, and it's something that the Corps knows how to do. The pandemic response is a little bit different, but where it's similar is that we are conducting all of our work under a national response framework, right? We are in support of FEMA under Emergency Support Function number 3, Public Works and Engineering. To date, we received 12 mission assignments for a total of $1.1 billion. And it's as Tony said, we're using that funding to convert existing facilities, whatever the states may have, whether it be a school, a dormitory, a gym, or an arena, and make it an alternate care facility, a temporary hospital. But just think about that for a minute. $1.1 billion, and that's growing. That's the equivalent. That's the annual civil works construction budget for our headquarters on any given year. As of this morning, we've completed 421 engineering assessments of these facilities, and we've moved forward on construction contracts for 7 of them in the New York, New Jersey area, Illinois, and as of this morning, Michigan. And we have several more construction contracts pending. So I understand it's very, very busy for everyone out in the field. This has been a full court press. And while we are executing this mission, we are not taking the eye off the ball on our other mission areas. So for our water managers out there, right, we know that flood season is right around the corner. When I went to my house last Friday evening, we had 150 river gauges across the country in some form of flood stage. I came back on a Sunday afternoon, they had jumped 50. We're up to 200, and we'll be at 250 river gauges across the country in some form of flood stage by the end of this week. And it's the same culprits, right? It's the Mississippi, Ohio, Missouri, Red River to the north, and a few others, all running high. For our planning and response teams, 60 days seems like an eternity from now, but in 2 months, we'll be entering hurricane season. We'll know we'll be ready. So it's as the chief said, right? We need everyone to be safe and healthy. We're in the early stages of a long marathon, and we're already running fast. We need everybody on the team. Hey, I just want to emphasize one additional point for all of you out there, and it's on the topic of public affairs. Many of you are already getting out there and telling our story. It's a good story to tell, but I'm encouraging more of you to get involved. So it's just like any other response that we have. We want to stay in our lane, right? We are in support of FEMA. We are one part of the Army's response to this effort, but here's what we are doing in our specific lane. And I would just ask you to use the framework that the chief has outlined in his vision, right? It's really a very simplistic 4-step process, right? The states are picking the sites. We are going to do the build for those sites. And then the states are going to work with Health and Human Services and FEMA on staffing and equipping those sites. So get out there and tell the story of how you are putting these alternate care facilities together as part of the build phase. And I'll end where Tony did. So whether you're working from home or you're out in the field or you're downtown in one of these cities where the American people need us, thanks for all that you do. Stay safe and stay healthy. Sergeant Major.
Okay, so thank you, sir, and to all joining us, just as the others, certainly thank you for taking the opportunity to plug in and listen to what we have to say. And I think I'll just start where many have either started or left off. At first, that is just to express my pride of this great team and the ability to serve as your Sergeant Major. But also, I think just for you to know that the reassurance that we bring to the American people when they know that the U.S. Army and the U.S. Army Corps of Engineers brings all their assets to bear through any hard problem. So I'm going to cover 4 areas, kind of talking to the health of our force. And I think I just want to go first to right where the chief hit. And that is the number 1 priority being the health and preservation of our workforce, and ensuring that we maintain the essential readiness that's required to support our nation in any contingency. And so with that said, I would just remind us all, right, to follow some simple guidelines, right? Clean your hands often, maintain that physical distance. I really don't like this term of social distancing, right? Because this is proof positive that we can stay socially connected, even though we're all maintaining some physical distance. I would encourage you to stay at home unless you absolutely have to leave your home. As the chief said, avoid those large gatherings. And then lastly, I would just commend you all that if you're feeling ill, and that if you have been designated as mission essential, that you reach out to your supervisor, let them know before you come into any office space and potentially result in additional quarantines or illness. I understand that many of you and your family members have lots of questions and anxiety about this epidemic, this virus. And with that said, I would just urge us all to get our information from unbiased and factual sites, right? So a few of those have been mentioned, whether that's the Center for Disease Control, Health and Human Services, or through your own State Department of Health, given the fact that this is across the entire United States. It's been said a few times that many of us find ourselves in new routines with the maximizing of telework, certainly can result in a feeling of a loss of connection and or collaboration. And I think that this point goes to every supervisor that's out there listening today, right? And it's your responsibility to be able to connect with your workforce and those that you lead through many, many medians. I've probably spoken more on the phone over the last 2 weeks than I have in the last 2 years combined to folks because I don't physically see them here in this space anymore. So supervisors, I would commend you to be creative with how you're going to engage your workforce and maintain connection and collaboration throughout this time period so that maybe we can lessen that curve that the chief spoke about that we'll find ourselves trying to overcome once we put this behind us and we all come back to work. And then lastly, I would just say if you're struggling with stress, anxiety, and loneliness, that I urge you to kind of either take a break from that saturation of the news that it's given you. The chief mentioned exercise. Maybe you can take the time to enjoy a hobby that you have that you just normally don't have time for. I saw that Tiger King is trending on Netflix, and although I don't know what that is, I've been binge watching some episodes of this On the Road Again. Not too bad. The guy that's in there's fairly high energy, seems to know what he's talking about. So that's what I've been doing with my extra time. Connect with others. We talked about it. And then lastly, what I would say is we've got 1,000 examples of world-class capabilities in the Corps, but I can think of few that are better than our world-class SISM teams. So reach out to a peer supporter that's probably sitting in your district, certainly within your MSCs. And then you can always reach out to that SISM hotline at 314-925-5250. So at no means should you think that you have to go through any of this alone. We all stand ready to connect and work through this. And with that, I'll hand it off back to the Chief of Staff.
Okay, ladies and gentlemen, as we transition to the question and answer period, once again, I want you to know that we've been collecting many, many questions over the past 48 hours. I've pulled out about 7 or 8 of those. I've pulled out about 7 or 8 of those, and we're prepared to answer those. And then we're going to go to live questions as well. So we're going to go ahead and get started. Okay, the first questions, they're going to go to our command surgeon, Commander Janisco. The first one comes from Andrea Owen out of headquarters here. The question is, if someone has had the virus before or once, can they get it again?
Yes, sir. So great question. Early data from the National Institutes of Health show that those who become ill and then recover will likely have a strong immunity and be covered for the 2020 COVID season. So again, we believe at this point as early data that if you have an infection, recover from that, you'll likely have good immunity for this season.
Okay, second question is also going to go to Doc Janisco. It's a trend question, came out of a couple of our MSCs. What can USACE do to obtain as soon as possible the proper personal protective equipment for our assessment teams who are out there assessing facilities and engaging with communities?
Yes, sir. So I'm gonna say the same thing the chief said before. First of all, only perform work that's safe. Again, making sure that we have the proper PPE to perform our work. Again, the best solution is keeping that 6-foot distance and not touching common surfaces. Now, if you can't do that by virtue of a job, speak with your supervisor, have them read Appendix 11 of Frag Ord 13, and that has the process to procure that PPE. So my understanding also is that DLA supplied New York with some PPE today, specifically N95 masks. So again, you're going to talk to your supervisor, go through that annex within the op board. If that doesn't come to resolution, call your safety professionals or call me, and we'll take care of it. Sir.
Okay, before we go to the next question, I do want to. We've received numerous questions here in the past, probably 6 hours, about hazardous duty pay eligibility. And I want you to know that we're on it, we're researching it throughout the headquarters here, and we're going to get you an answer on that. So don't quite have an answer for you on that yet, if any of you had that question. The next question, we're going to go to our Human Resources Director, Ms. Payne. First question is from Eric Ford out of Galveston District, and Steve Pranger from Erdick. One of our labs asked the same question. How do we volunteer to support the response efforts for the alternative care facilities as construction representatives or in any other roles?
First of all, I just want to thank everyone for all your real great work, and I'm just proud and honored to be part of this team. And I also want to give best wishes to your family during this time. I also want to thank Mr. Ford and Mr. Pranger for this question. We've actually had numerous inquiries about volunteering and opportunities to support the mission, and again, that speaks tremendous, dedication to our world-class workforce. Right now, the engineering and construction team is actually developing a system for interested employees to self-certify relevant skill sets needed for the ACF mission and other parts of the mission related to COVID-19. Your divisions and districts can work with you and also with the team to request access to find qualified individuals. So we're getting we want you to go in, and this system is going to be actually on the Knowledge Management HR portal site. So you can go in there, go through Knowledge Management portal, and look at HR, and the system will be there. You can go in, put all your information. Then we're going to take that, look at what the G3 is getting for requirements, and be able to build that. We're going to try to keep, and even G3 can add in, but try to keep people in the local area as much as possible, looking at what the requirements are and what your skill sets are, and be able to align those. Additionally, please talk to your supervisor, because we've actually already sent out, needs that for the mission, and so they may have information on that. But they also need to know and work with you if you're volunteering for these kind of activities too. But just remember, we have a lot of missions in the Corps, and whether it's the COVID-19 or other missions, all very critical, and really do appreciate everybody's support and also their expertise in dealing with all of our missions.
Okay, we're going to stay with human resources for the next question. How will the stop move affect our soldiers and civilians, particularly during what is normally a heavy summer rotation period? When will guidance for this be published?
Okay, right now the stop move order is until 11th of May. We expect more guidance coming as we get closer to that date, and then we'll be able to really to look to see what guidance are coming out for the summer rotations. So more information to come. We don't exactly have it yet, but we will be getting it, and we will be getting it out as soon as possible.
So let me just jump on a little bit there. The Pentagon, pretty wired tight. They are right now working in the middle of June and July. They're trying to figure out how many people do they recruit, and what's the recruiting station going to look like, and will there be people in hospitals? They're trying to figure out things like exercises. This 11 May date was a date that was set 3 or 4 weeks ago. Okay, that was just a barrel shot over the bow. We are going to do nothing until 11 May. Don't put a lot of credibility into that, okay? Because a lot of things have happened. And most of what we're seeing is that the curves of most of the nation are 24, 25, 26 April, something like that. So it's going to take a while to come back over that. We have seen a lot of you that have had your absolute personal lives destroyed. You probably had a wedding somewhere there. There were people out there that had a cruise. Somebody went to Afghanistan to serve our country, came back from 9 months, and you were all going to end up being able to do something fun, and they had to go into 14 days quarantine. Somebody probably had a spouse who had a baby, and you were told you couldn't even go into the delivery room. So everything is going to be up in the air. We can't predict anything. What I would tell you is to stay extremely flexible. We're going to continue to try to look about 30 days out. And we have decision points here. So when we come upon a big thing, then we will start saying 2 or 3 weeks out, it's probably prudent to move that to the right. some of the things we have, the communities of practices, you have some amazing conferences, you have some great training. We're hesitant to necessarily cancel anything, but we'd like to think we can push that to the right just enough to stay ahead of it. The biggest single unknown, and a lot of this is going to depend on the Pentagon's policy, is what's going to happen to change of commands. We'll just have to play that out. There could be a scenario where your change of command is, two colonels in an office giving a cell phone back and forth, and that's all it is. So don't worry about it. We'll say goodbye to the old guys at some point. We'll bring them back for barbecue. But at the end of the day, focus on the mission, focus on protecting yourself. And there's next to no predictability in anything that's out there in June and July. And I only say that because I'd rather you walk in to understand that everything is all on the table instead of thinking that there's a bunch of things that are magically going to turn on some given day, because we just don't have that level of resolution. Thanks.
Okay, we're going to go to contracting for our next question. Ms. Stiglich, this question comes from the Seattle district in Van Woods. Many private sector engineering service providers want to know how to volunteer their services and products, some of them for free, to support the COVID-19 response efforts. Is there a centralized place to direct them locally and/or nationally?
Thank you very much, Mr. Woods. I have never seen so many contractors want to help in these efforts in my entire career, so thank you. If they go to our headquarter USACE website, there is a red tab titled Hot Info, which will take you to our contracting webpage that gives you our mailbox. Tell us what capabilities you have, and our contracting folks will review and see if there's any way we can utilize your services or products. Our mailbox is covidcontracting@usace.army.mil. We also have a one-page guide on doing business with the Corps of Engineers on our website. As far as working for free, you can come to my house first. That's a joke. And they can contact their local FEMA offices for volunteer efforts. That website is https://www.fema.gov/emergency-management-agencies. If we do find a fiscally acceptable way to accept these free services, we'll let everyone know. Thank you, and contracting is all in, sir. Out.
All right, thank you, ma'am. Next, we're going to go to resource management, Mr. Steffens. This question comes from Tad and Danny Rivera. Have discussions begun on how the United States government is going to pay for the stimulus package and projected future packages? Example, should we anticipate that cuts or deeper cuts in some cases are forthcoming for ED&M, OCO, and projects? And finally, do you anticipate a hiring freeze, and what is the risk level of a potential furlough?
Thanks. Well, first, I just want to thank Mr. Rivera for such an insightful question. I, as a fellow concerned citizen, wonder about the $2 trillion stimulus we received, by far the largest in the history of our nation. And he's got a great question. How are we going to pay for it? And what's the implications potentially, for our federal government and specifically for USACE? Although I can tell you at the federal level, there's been discussion about it, but there is no official plan on how to compensate for that, other than that, that amount gets added to the national debt at this point. I will tell you that at USACE, we're concerned about that, and we're concerned about the overall economic impact to USACE in terms of our projects, execution, the fact that contracts, may have to be extended. We may have to, for example, work closely with the Army on potentially getting reprogramming actions so we continue to execute these projects either this year or next year. And we have to continually look at and other options where we just need some additional funding. We are coordinating with the headquarters Department of the Army on a daily basis on what are those things that are COVID-19 related that USACE needs in order to continue to execute our mission. Now, as far as the workforce goes, and he specifically mentioned ED&M, which is, as you know, is our headquarters budgets for both the civil works and for the mill programs. I can tell you, as a track record right now, before COVID-19, there's been enormous respect for USACE and what we do. Our budgets have been very robust and steadily funded, and that's a reflection of the confidence that the federal government has in USACE as a strategic asset in our nation as far as our mission. So right now, no signs of a hiring freeze. In fact, hiring is ongoing right now. Some of the programs Ms. Payne has introduced as far as direct hiring authority have actually enabled us to accelerate hiring here, both this year and in the future. Thanks.
Thank you, sir. Okay, the last one before we go to the live questions goes to General Semonite. It comes from Bitsy Sloan and MVD. Uh, Sir, for the current mission, was there a specific point at which you realized that USACE could help? And what curve were you trying to outrun? And what alerted you to it?
So, Bitsy, a great question. And most of the time in FEMA related missions, we wait for the phone to ring. We wait till the hurricane passes. We let the state and the locals try to do their work. And when all of a sudden they're overwhelmed, they could variously call and say, we need the federal team to help out. We had a request from a very passionate governor who asked the President of the United States, I need the Army Corps of Engineers. This is going to completely wipe out my state. And it was Governor Cuomo from New York. And he said, I need the Corps of Engineers to come and help me out. And so we flew up within 12 hours and had a pretty talented team. And we met with the governor and actually walked through what would we do with this standard design that General Funkhauser talked about? How would we put this on the ground in the state of New York? And we came up with some very simple options. And we knew there's no way we can design 500 buildings. So how do you have something that's relatively right? And then you excite the passion of the rest of the core team to be able to leverage a standard design. And then what we do best in the Corps is decentralized execution. Give it to the guys with the green shirts. He and she will do a great job with the red shirts, run around with the red and the white shirts on, do a phenomenal job out there and execute it. So we're flying out that night out of New York City, and it really did dawn on us that the problem we had in New York, if anything, probably New York could probably deal with it better than an awful lot of these other smaller states that don't have the capability to do their own contracting and their own work. So we did come up with this concept and then really go back and just to be able, without a tasking, we've actually went out to our commanders and our senior civilians, SESs, DPMs, and said, if you need a capability, this is probably a pretty good tool. So I think the big curve we were trying to do is to be able to anticipate where is this top of the curve for every one of the cities, and they're all different. Some are 5 or 6 different days apart, but somewhere middle to the end of April, where's that curve? And if a city needs help, are we good enough to be able to get in there and to do the mission essential task we need to do to get a hospital capability? I think this goes back to what Mr. Steffen said, and to a degree, the reputation of the Corps of Engineers. And this is not a reputation that we make here in headquarters. This is a reputation that those of you that have been with us for a long time, whether you're a park ranger, whether you've deployed to Iraq and Afghanistan, you have done an expeditionary job to go wherever the United States needs us to go, to be willing to step up. And it basically got to the point where everybody knew the Corps here and the Corps can help us find a solution out to this. So it's the ability that now that they know we're available, how do they continue to lean on us to be able to make it happen? And I would just continue to say that there is no tasking, there is no mission assignment to say, go solve all these problems. But we don't have the time here for those Americans that have the potential to die. We don't have the time to wait for the phone to ring. We need to anticipate where that signal is going to come from. And then we need to send some super high speed USACE civilians, get some red shirts and some white hard hats out talking to mayors and governors and saying, we have an option. You ought to use it if you so are so inclined, because at the end of the day, you don't want to be short hotels. Great question, Bitsy.
Okay, we're going to go to the live questions. And I don't know that I planned on answering some of these myself, but I think I'm going to be doing some of that. The first one I'm going to go to, though, is a question from Lisa Albert. Does USACE have any plans to send support to the UK? I'm going to let, I will tell you that Major General Jeff Milhorn at NAD is the one primarily involved there, as their district is over in Europe. But I'm going to let General Funkhauser comment on that.
Yeah, Lisa, thanks for the question. Yeah, absolutely. We have posted the plans for both the hotel conversion and arena conversion as an exportable package on our website. When we found out we had international partners asking, and there's been a number of them, we made an effort to go back to Huntsville and identify what we needed to do to have international conversions for power and whatever other requirements. So they've done that for us. And now, like in the case of the UK, who have asked us for assistance, we're working because we're part of DoD. We've got to work with the Department of State and the Geographic Combatant Command. But the intent is to share everything we have with everyone that asked and to support the community. Over.
Okay, I've got a couple. There's one. We do not have G6 in the room. He is, our leadership is ensuring that this town hall continues to operate, so they're at outside locations. However, I think Mr. Peoples is available to type in and answer any questions you may have. That was the plan. That said, this question, are there plans to improve the speed and connection of our VPN? It is nearly impossible to use GIS software off of VPN. Great question. I do know over the past 10 days, we improved greatly with some refurbished equipment that we got in. We shut down for, reduced the capability over a weekend for about 12 hours and got a lot more capability stood up. Additionally, we're moving forward within the next 10 days to increase that capability, and I hope that helps the GIS. But we owe you more information on that, and I would ask Mr. Peoples and G6 to research that and get an answer out to our enterprise. The next one, it's trending, how to share web links briefed in this town hall. We've mentioned a few of them. We will roll that up and send that out to CDL, all Corps of Engineers, to make sure you all have those web links. And then there's also trending, as I thought there would be, because there were numerous questions about teleworking the past 48 hours. And I did talk to the MSC commanders this morning during our 0900 and UOC update. The guidance that was published as it pertained to teleworking, we've really delegated decision-making and the authority down to individual district commanders, and in many cases, the supervisor level, because based on where they're located, it differs across the entire Corps. We could have a very remote dam, a very remote resident office that is not currently heavily impacted. So they're probably going to need to tweak how they do things. But if you're generally asking how long we will be teleworking, for example, I'll just use here, Virginia and Maryland have put really stay at home in place through the 10th of June now. That was the date that went out last night. So the folks in this area that work at headquarters, you should expect that we will be max teleworking at least through the 10th of June, unless something major happens and the threat decreases a lot and the governor's back off of those types of restrictions. So that is delegated. I would ask you to feed those questions up to district command leadership and to the MSC leadership, and they have the authority to implement what makes sense for specific and local areas. I may ask you, General Simonite, to come up on this one. This is from Sandy Justman from SWD. How do you decide on what cities to set up the temporary hospitals camps? Is it by the number population of COVID-19 patients that hit a particular city?
Sandy, good question. What we're really doing, and I think we talked a little bit about the modeling that's been done. We're taking 2 or 3 different models and we're trying to figure out what is the best use of them. And we're really seeing it's kind of a live shot. And you can kind of see America and you can see cities turn from kind of purple to kind of red to kind of bright yellow. And then we see, hey, here's where we think the biggest challenges are going to be 2 or 3 weeks out. We've also got some analytics that actually say where are the shortage of beds. So it's not just where's the worst case, but how do you juxtapose the worst case with the bed shortage and then try to figure out where's the gap? And I hate to say it, but some of these cities, they just don't have the depth to be able to necessarily understand what is coming upon them. So this is where every one of you probably have somewhere where you might be a volunteer in your local town. You might be a selectman. You might be in the Rotary Club. You might be out there, helping to do the alumni parade. But at some given point, where is your town? Where's your city? And I'm not even worried about the gigantic ones. We've got the big ones. But just think about the one that's got only small clinic. You might not even have an authorized doctor. You might have a nurse and a couple of EMTs, and all of a sudden you have 2 or 3 people that have a challenge. What are your towns doing to try to get ahead of this? So we basically have no prioritized list. There's nothing that said from the White House, only deal with this state and only deal with this city. we are going everywhere, and we're gonna probably run you hard, because what we're saying is we have the ability to at least get some leader out talking to a local elected official to understand what the requirement is. And that's where we talked about some of the arena things, but some of the easiest ones is to take something like a 3-story hotel, like we always stay TDY in, it's $100 a night, and just put that whole thing off limits and make it COVID only. We can do that in a matter of a couple days. So this is where we really want to try to make sure we're connecting out there to anticipate where the requirements are. And at the end of the day, the Corps of Engineers has enough depth to be able to take care of all those requirements, because as Jill said, the phone is ringing off the hook with people that want to help us. It's amazing.
Right, a current trend right now is the process for reporting sickness, possibly positive COVID-19 test results to the district. I'll just tell you, and then I'm going to go to the G3 for him to maybe expand a little bit more. We are submitting those up as commanders' critical information requirement reports, and we're not sending names necessarily, but we're sending up numbers so we can keep track of the health of our force and ensure leadership's checking on individuals that aren't feeling well. G3, can you add to that?
So, Roger, Colonel Gibbs, that is the way it goes up through the CCIR process. And then beyond us, when it goes outside of here, it goes up to the Army, and then they have a process that they do through their chain that goes up to higher levels of government, OSD and beyond. So there is a tracking process. We do make it as anonymous as possible to protect everybody's privacy, but it does help notify the command and for us to kind of pay attention. And in addition, if it's a question in a personal realm, have a conversation with Commander Janesco, have a conversation with your supervisor. And if you think you are sick, like it's been said a couple of times, don't come to work, call them, err on the side of caution.
Okay, thanks, Jason. Okay, I'm going to go to Commander Janisco on this next one, and anybody who can help is welcome as well. But what is the plan? This comes from Rudy. What is the plan to ensure the safety of power plant employees and staff as they continue to come into their facility?
Roger, sir. So we have two plans. The first one is there's a voluntary temperature screening process that was sent out through safety, and for critical facilities specifically. So if there's a critical facility and the commander and the safety team assess that there's a requirement, there could be someone who could voluntarily check people's temperatures. And that's one of the when you look at all the symptoms of COVID-19, that's one of the ones that really is consistent about 99% of the time. Secondarily, there's some self-responsibility here. So making sure that you're checking yourself, checking your family, checking your buddies, right? If someone's not feeling well, making sure they don't come inside that building. Sir?
Okay, from Sarah, will shelter in place affect Army child care subsidy? Can either one of you? We need to do some research on that. Okay, good question. Go ahead, ma'am.
Let me get back to, let me find out. That's a good question. I will get back to you and we'll get that on our, again, we'll put all these questions too, especially HR related, on our knowledge management portal site too. But we'll get back to you on that.
Thank you, ma'am. From Bill Noel, with all the temporary medical facilities being built, is there any projection that the temporary housing PRTs may need to be mobilized to set up housing for workers coming in from different areas to support? General Spellman.
It's a great question. Thanks. Because we've been asked this question about the planning and response teams and the FS. I would just say all capabilities remain on the table. What we don't want to do is something that the Army learned late last week, and that was there was a recall for retired medical professionals to activate them, bring them back onto to active duty. And what we found was that they were actually taking medical professionals out of community hospitals across America. So the Army stopped that. So what we don't want to do is pull folks off of teams that are out there doing engineering assessments in the field right now and have to pull them over to a FEST or to a PRT when they're already working. But we'll keep all the capabilities on the table, and we'll deal with all of this on a case-by-case basis.
Agree. This whole idea of we've got to have enough standby capability to prepare what's not going to happen, what we don't know about. Regardless of what happens with the virus, Mother Nature gets a vote here as well. In the last 3 years, we have not necessarily had relatively good luck with Mother Nature. So if all of a sudden we get a Maria or an Irma that comes in and now has devastating, catastrophic effects right on top of all of this other stuff, it's just going to make it so much more worse, because now you're going to have injured people that are going to be into the same hospitals, and we've really got to kind of think through. So we've got to have a little bit of a reserve repository. Yesterday, senior leaders in the Pentagon actually said that some of these towns, if they get infected real bad, might almost shut down. Things like the public water, the electrical. What about simple things like sanitation or other kind of capabilities? And is the Corps of Engineers prepared to come in and be able to turn towns back on to do infrastructure repair? We've got that capability. We don't normally do that under the different authorities we have, but all of the team here, the senior leaders, are trying to predict what else can be thrown our way. And without spending a lot of additional effort, how do we make sure that we've got enough reserve in the gas tank that if we get called upon to do something really tough, we can continue to step up? The other thing I want to stress here, and this goes back to Ms. Payne and HR, none of you are limited from bringing more people on. We're going to be overwhelmed. So at the end of the day, rehired annuitants, temps, terms, if you got rehired military out there, we've gone to troop units like brigades and the theater engineer commands. We've even gone to the point, and you remember this during BRAC, when we were short people in BRAC, we did a thing called CMS, Construction Management Services. We would go to a company and rent 20 electricians. If you need anybody you bring them on. This is not a time of trying to figure out how to pinch a penny. It's to have all the people we need on standby. They wear a white hat, they wear a red shirt, they work for the Corps of Engineers, but they might be a contractor helping you do your job, because at the end of the day, you could very easily have some of your people affected, some key people. They're going to be out of the count for 13 or 14 days. And we got to make sure we have not only technical capacity, but the leadership to be able to step up and do what this nation needs us to do.
All right, thank you, sir. Okay, I've got one that's come in from a couple of different folks asking what geospatial models is USACE using to predict the COVID spread? And I'm going to ask our AGC, Colonel Dave Hibner, Mr. Gary Bloom, out there to please answer that, and we'll get it pushed out to the enterprise. This comes in from headquarters. It's going to go to Commander Janisco. Can COVID-19 be dormant after 14 days with no symptoms and still cause damage to lungs, body? Lungs or body? You know the answer to that, Tom?
Yes, sir. So I'm going to reframe it a little bit. So typically, most people have fever, chills, cough, shortness of breath between 2 and 14 days. Most often, between 5 and 7 days, they'll become symptomatic. There are some people that are asymptomatic. So some people will have a transmission of the disease, and their immune system's kind of chugging away. They'll have maybe a low-grade fever, but that's it. During that time, those people may be shedding the disease a little bit, so they have the virus coming off a little bit, and which is the reason for that 6-foot distance, to be clear, okay? In terms of if someone had the disease, then the 14 days have gone by, would they continue to have lung damage, I think was the question. There's insufficient data at this point to answer the question. Anecdotally, people who have recovered in China, who had some level of lung symptoms, did tend to get somewhat better, but somewhat is not a very good metric. So we're looking into that more to follow.
Okay, Mr. Steffens, I'm going to come over to you for a couple of I think you had this from yesterday, but the $2 trillion CARES Act. Can you talk about that? How that would affect funding for future projects? What and how will our leaders determine which projects will go forward or not? And some of those questions that were asked. I know you prepped for that.
Yeah, sure. Now, I'll tell you that both in civil works and in military programs, the leadership there, as well as the leadership at every district, is looking at those programs and are seeing what the impacts are. Different programs are impacted in different ways, depending on where the location is, the nature of the work that's being done. So obviously, it varies. However, I will tell you, as I mentioned before, there are being measures put in place to either get resources, number one, or potentially request reprogramming actions to address resource shortfalls that may occur as a result of a shift in these in that work.
Right. Thank you, sir. Going to go to HR. We're getting close to the end here. Just a few more minutes. Ma'am, the question is from Penny Lett. Is DP map going to slip the date for whether it's plans or whether it's the evaluations?
Well, Penny, a good question is actually something that we actually brought up at the Army HR Board of Directors meeting on Monday. I have to tell you, MNRA and AG1 CP at the Army level has been really, really supportive. And quite a few commands actually brought that up, the same question about the DP map. What they're doing is they're actually looking at right now, talking to DC Pass to see if we can get some of that slip. What I would tell you right now is we're holding with the dates. But if you're having any issues, that's for all, please, shout out to me, send out an email. I'll get that to appropriate person. We'll help you through that. I mean, this is a good time, even like when you are teleworking, to do your DP map, your performance evals, those kind of things. That's something that we could do electronically and everything if you have it available. But I know there's some cases where you don't and you're on a work site. So please just let us know. We are here to support you. We're going to do everything possible to get you through this. I know that Army, again, is looking at it, and they also understand that a lot of people are very busy and might not be able to even get to it. So more to come on that. We'll be putting some information out soon. And and again, we're here to support you. So any specific questions, just send out to HR and we will definitely answer them and work with you on that process. Over.
All right, Mr. Steffens, one more, and we're about to wrap up. With year end coming, have you heard any discussions on changing the end of fiscal year or extending one-year funds?
Ironically, we're at the midway point exactly today, right? It's 31 March, right? So at this point, no. We think that, we didn't change fiscal year after 9/11. If you remember, it was only 20 days, less than 20 days from 9/11 till the end of the fiscal year, and they closed out flawlessly. So I anticipate this fiscal year will come and go, and we'll close out normally, and we'll do so well-resourced over.
Okay, thank you, sir. And here's a message from Mr. Peoples on the VPN bandwidth, particularly as it pertains to GIS. Our G6 is working with the Army Geospatial Center to address their issues, the app issues. They have reduced download times. If users have special apps that are having issues, we'll continue to work through those with the IT chiefs. And we continue to increase bandwidth across the enterprise to allow better access to those mission apps. And then I think there was another question I got as well as it pertained to hiring. Hiring processes are going to continue, particularly for those vacant FTEs that are out there. If you've got a mission specific, the question that came in is, can you bring on a rehired annuitants if the workload is increased for a short period of time? And the answer to that is absolutely, for a short period of time. It would be a temporary term hire to get the work done, get you caught up based on how much the workload is delayed throughout this time period. And those come up, I'll approve them, and we can bring folks on. So we're one of those few agencies, as General Simonite keeps telling the commanders, that there's a lot of people out of work, and if we need help and they have those skills, we can bring them on and put them to work and get work done. Okay, with that said, we're going to cut it off there for the questions. I appreciate your time, and this concludes the Q&A. Very much appreciate. Did we get a final number on how many dialed in, or no? So it's at least 8,000, maybe more. Thank you for your participation. I'm going to turn it over to General Simonite for closing comments. and we will be putting additional answers to some of your questions out, particularly those that were trending, and getting the information out to you. We'll provide web links. This actual session, of course, can be replayed. We'll send the link out for that as well. For those employees or some of those folks that work for you that did not get to link in today, they'll be able to watch this later. We may have a future town hall, but we will make it an effort to get messages from the chief out as we go in the coming weeks through this fight, and we continue the mission for expanding our hospital bed capacity across the nation. With that said, I'll turn it over to General Simonite. Thank you.
Hey, thanks, Kurt. And the Mr. People did a phenomenal job. We've never done one of these before, but I think it was very well received. You might have saw that every now and then we're walking over. We have a big screen over here on the side, and you're typing in. I can't even read them as fast. The thing's just flipping through with all the great comments in there. And what we're going to do is go back and make sure that we document all these, and we'll get you answers back there. Let us know what works. If this is a good medium, that's great. If it's better that you do it with your MSC commanders down, I can tie into an MSC, whatever you want, but we want to be able to make sure you talk with it. 3 final points. First of all, this nation is going to take a long time to rebound. What we saw in ARA, a lot of you remember ARA, the economy was on its rear end. And there was a lot of money pushed into the Corps of Engineers and a lot of other agencies to stimulate the economy. General Spellman just got turned on about 2 weeks ago in one of the big supplementals in a couple of very, very specific civil works areas that we never expected we would get turned on. We have more money and flexibility. General Spellman just got more millions of dollars in the civil works account to be able to help us do some of our missions here. We're going to say the same thing when it comes to some of the other areas that either FEMA needs us to step up on or whether it's DOD. We are an income generator. We grow the economy, we hire people, and we make things happen. So regardless of our regular normal missions, for those that might think this is doom and gloom, I'm telling you exactly the opposite. When we get turned back on, it's going to be crazy. And we're going to have a regular mission, and we're going to have a lot of other missions because someone's going to want to get unemployment down, be able to get GDP back up. The Corps of Engineers is one of the best capabilities. Think about infrastructure packages, a lot of capability being kicked around on the hill. So just be ready to go. You know, I always watched NASCAR, and I've never really been on a pit crew, but it's kind of like we're behind the wall. We can't do anything. The cars are going around, and there's a time, 2, 3, 4 months from now, I don't know when that car is going to come pulling in. And we got 13 seconds to change the tires, and then they're going to be back out. And when you come over the wall, you don't have 7 seconds to ramp back up. You got to be hitting the ground running. So think through, do you have all the people? Do you have all the capability? What else can you help us do so when we get turned on to go hot, we're able to help deliver for this country? The second thing out there is I can't tell you enough the accolades I get. The White House, unfortunately, has my cell phone number. My aide walks around, my phone rings. I get a lot of guidance, and most of it is questions like, what else do you possibly need to help do your job? And I won't tell you who, but as senior leaders who are asking, what else can we do to set the Corps of Engineers up for success? I'm hearing the same thing with the Secretary of Defense. Secretary of the Army calls at my house at night and asks me, what else do you need? The Corps of Engineers is very, very highly respected. I hope you're feeling it. But the bottom line is everybody knows the value. We don't do this to get stroked. We do this because we see a need. And right now, there's an unbelievable requirement out there. And you need to know that America represents the power of what you do. I go on Facebook about 11 o'clock every night when I get tired. And I was in the other day and I saw like hundreds of people running around, men and women in red and white shirts in convention centers, lifting up doors, trying to figure out how do I jam a hospital in the middle of a tennis ball court? How do we do all this kind of stuff? And just our team that's out there, the reassurance that you give. And I'll end with my last point is that if this is a sea of despair, everybody in America is looking for kind of an island of hope. Where is there a path ahead? How do we know that it's going to be okay? And you probably think about this when you think of a soldier with a uniform out there and you were to walk in on a storm and here's the National Guard and they're there deployed. Everybody kind of feels like, oh, the National Guard's here. You guys have just as much, if not more, of a reassuring nature. I'm big on, hey, get the red shirts on the street, get the white hard hats, get the machines out. put the magnetic things on your car. When you drive down the street of Midtown America, I want people to know the Corps of Engineers is here, ready to respond. And whether we build something or not is not the most important thing, but just knowing that you got a professional, world-class organization in town, in your town, trying to make a difference for your families and for your neighbors, and just the peace and calm and the confidence that we bring, knowing that the United States Army Corps of Engineers is ready to do what we need to do, is what America needs. We need a glimmer of hope. You bring a lot more hope than you ever could possibly imagine. I don't care whether I got to buy 36,000 red shirts and tell them you wear for the next 2 months, but get out, be visible, stay 6 feet away from everybody. Don't go in groups, but let people know the Corps of Engineers is here, ready to step up and help America out of this time of need. Thanks so much for being on the net. Stay safe. We'll be talking to you next couple of days. Out here.